Welcome back to the podcast. If you've ever had to seek specialized medical care in West Africa, you know exactly what the current script looks like. It starts with a referral, followed by weeks, sometimes months, of waiting for an open slot. Then comes the day of the appointment, navigating hours of gridlock traffic, fighting for parking at an overextended tertiary facility, and sitting in congested waiting rooms for half the day, all to get a precious 15 minutes with a consultant. The physical and emotional toll this takes on a patient is staggering, but the systemic strain is just as heavy. Our premier referral centers are completely choked with routine follow-ups, leaving little room for critical emergencies. But what if we could rewrite this narrative entirely? What if we could decentralize specialist care, making it secure, continuous, and accessible right from your smartphone? Today, we are diving deep into a platform that is doing exactly that. AllRound Specialist Virtual Clinic, ASV Clinic. And I am absolutely thrilled to welcome the co-founder himself, consultant physician, gastroenterologist, and senior medical leader, Dr. Kenneth Tachi. Dr. Tachi, thank you so much for joining me today.
Thank you very much, Priscilla. It's an absolute pleasure to be here with you and your audience. You've laid out the challenges perfectly. It's exactly those daily frustrations of both patients and clinicians that drove us to build AllRound.
Let's start with a foundational baseline. For many people, that telemedicine in developing countries translates to exchanging casual text with a doctor on WhatsApp or making an unstructured voice call. Could you introduce us to AllRound Specialist Virtual Clinic and explain how you are completely shifting away from that casual approach?
You hit the nail on the head. Informal chatting over messaging apps lacks data security, structure, and clinical continuity. It's a temporary band-aid, not a health solution. AllRound is a fully integrated, HIPAA-compliant, and GDPR-ready digital hospital ecosystem. We are certified by the Data Protection Commission, DPC of Ghana. Through the AllRound Health App and our web portal, we have aggregated a global network of highly qualified, certified medical specialists across more than 30 disciplines, from cardiology and endocrinology to pediatrics, and my own field of gastroenterology. We provide secure appointment-based video and text consultations backed by a full personal health record (PHR) system. Patients own their data 24/7, and our platform allows for electronic prescriptions to be sent directly to partner pharmacies and diagnostic hubs, completely closing the care loop safely and professionally.
It's that structured ecosystem that makes it a true clinic rather than a chat app. Now, let's talk about the economic and social friction under the current brick-and-mortar paradigm. For individuals managing chronic conditions like hypertension, diabetes, or gastrointestinal issues, missing a single review because of logistics can lead to a massive crisis. But looking at the bigger picture, this friction bleeds directly into the corporate world. Businesses suffer immense losses from absenteeism, where an employee takes an entire day off just to sit in a hospital waiting room, and presenteeism, where they are at their desks but completely unproductive because they are secretly unwell and delaying care. How does AllRound step in to fix this for both individual patients and corporate employers?
That is the massive hidden economic drain of traditional care models. For an individual managing a lifelong condition, consistency is everything. AllRound gives them instant access to their specialist without the travel barriers, automatically sending them reminders so they never miss an appointment. When we scale this to our all-round corporate wellness partnerships, the impact on business operations is profound. Instead of an employee losing a whole working day to see a specialist, they can step into a private wellness room at the office or use their phone during a break. They get high-tier specialist advice, an e-prescription, and are back to work in 30 minutes. We catch complications early before they turn into expensive emergency crises or prolonged medical leaves. Employers see reduced absenteeism, happier staff, and a significantly optimized corporate health budget.
It's a brilliant way to protect a company's bottom line. But what really fascinates me about AllRound is how your solutions extend into very specific, often overlooked sectors. Let's look at hospitality and tourism, for instance. When an international traveler or business executive falls ill in a hotel, it can quickly turn into a logistical nightmare for the management. They have to scramble to find a reliable doctor or dispatch a high profile guest to a chaotic local ER. How does AllRound change the game for premium hotels?
For the premium hospitality industry, peace of mind is part of the luxury experience. Through our all-round hotel partnerships, we equip hotels with an on-demand virtual medical concierge. If a guest feels unwell, they don't need to leave their room or guess which clinic is safe. The hotel provides access to a secure all-round consultation link, and within minutes, the guest is speaking face-to-face with an accredited specialist. E-prescriptions can be routed to trusted pharmacies that deliver straight to the hotel lobby. It elevates the hotel's guest care to an international standard while keeping everything legally compliant and safe.
That is an incredible value add. Now let's pivot to two other crucial sectors: non-governmental organizations, NGOs, operating in the field, and health insurance providers or health maintenance organizations, HMOs. The current pain point for insurers is clear. Late diagnoses and unnecessary ER visits cause claims payouts to skyrocket. And for NGOs, keeping remote field staff healthy where there are zero specialists nearby is a massive challenge. What are the solutions here?
For NGOs, our virtual clinic acts as a geographic bridge. Their field teams or the local communities they support are often stationed far away from major medical hubs. AllRound allows an urban-based specialist to project their expertise into the deepest rural areas, supporting field clinics and keeping staff safe. For health insurers and HMOs, the value proposition is rooted in proactive cost containment, late-stage chronic complications, and preventable ER visits are what drain insurance funds. By integrating AllRound into their insurance packages, HMOs provide their clients with a premium, friction-free digital entry point to care. When policyholders see the right specialist early, we drastically reduce total claims costs, control premium inflation, and dramatically improve patient outcomes.
It completely aligns financial incentives with patient wellness. Let's dig into the core clinical mechanics that make this level of prevention possible. In traditional medicine, a doctor only knows what's happening to a patient during that brief moment they are sitting in the consultation chair. The rest of the time, the patient is in a black box. If their blood pressure spikes or their blood sugar crashes at home, nobody knows until disaster strikes. Furthermore, smaller community clinics or district hospitals often lack full-time specialists on the ground to manage complex cases. How do your solutions of remote monitoring and telerounding step in to shatter these limitations?
This is where we transition from basic consultation to advanced, continuous clinical management. Let's look at remote monitoring first. A patient's health doesn't stop when they leave the clinic. The AllRound Health App integrates with over 50 specialized health trackers and can sync seamlessly with compatible Bluetooth medical devices like blood pressure monitors and glucometers, as well as Google Health Connect. Our specialists deploy customized interactive care guides for patients. If a diabetic patient logs an alarming blood glucose trend at home, our system triggers an automated alert to our specialist team. We can step in, adjust their medication virtually, and prevent a diabetic coma before it ever occurs.
And how does telerounding apply that same logic to local hospitals?
Telerounding is our answer to the geographic disparity of medical expertise. Imagine a small district hospital or a private clinic in a remote region that has a patient admitted with a complex kidney issue or a severe neurological case, but they don't have a full-time nephrologist or neurologist on staff. Through all-round telerounding, our senior consultants can virtually join the local medical team right at the patient's bedside. Using secure, high-definition video and data sharing, we can review charts, look at the patient, and co-manage the case alongside the local doctors and nurses. This drastically upskills local healthcare workers, avoids the dangers and costs of emergency patient transfers, and keeps the patient close to their family support network.
That is a revolutionary blueprint for health equity. It brings us to the biggest question of all, the systemic macro impact. Across developing nations, health systems are battling heavy fragmentation, a severe brain drain of medical professionals moving abroad, and overwhelmed public infrastructure. Dr. Tachi, as an academic and a frontline consultant at a major teaching hospital, you see this strain every single day. How can AllRound be integrated into existing public and private health frameworks to create a true systemic victory? And how can governments and policymakers assist you in scaling this?
Priscilla, we must make it clear that AllRound was never built to replace physical healthcare infrastructure. It was designed to be a digital force multiplier for it. We integrate with and lift the existing system in three primary ways. 1. Decongesting tertiary centers. If we can move routine chronic care, follow-ups, and secondary reviews out of physical hospitals and onto AllRound's digital platform, we immediately clear out crowded corridors. This frees up physical beds, clinics, and staff at public teaching hospitals to focus entirely on acute, complex emergencies that absolutely require hands-on care. 2. Mitigating brain drain. Telemedicine allows us to aggregate the power of the specialists who are still here, maximizing their efficiency. Furthermore, it allows us to tap back into our medical diaspora. A Ghanaian or West African specialist living in the UK or US can seamlessly log on to AllRound and consult for a patient in a rural community back home, reversing the brain drain digitally. 3. Feeding the local healthcare economy. We explicitly close our care loop using local brick-and-mortar businesses. When an all-round specialist orders a lab panel or a CT scan, the patient goes to an existing local diagnostic center. When we write an e-prescription, it is fulfilled by a neighborhood physical pharmacy. We are pumping economic value back into the local health ecosystem, not bypassing it. Now, to make this nationwide and regional, governments and policymakers have a massive role to play. First, we need clear, standardized regulatory frameworks that institutionalize telemedicine, ensuring it is fully recognized and governed by national health professions councils. Second, policymakers can assist by integrating virtual specialist care pathways into national health insurance schemes like the NHIS in Ghana. If the government incentivizes public-private partnerships with platforms like ours, we can dramatically reduce public healthcare expenditures while expanding specialist reach to millions.
It requires that collaborative ecosystem thinking to truly scale. To close things out, Dr. Tachi, let's look at how far you've already come. What are some of AllRound's major achievements and partnerships that demonstrate this model is already working?
We're incredibly proud of the steady traction we've built. A major milestone for us is our full certification by the Data Protection Commission, DPC, of Ghana, which gave corporate clients, insurers, and international organizations the absolute confidence to trust us with sensitive patient data. We have successfully forged deep clinical and technological partnerships with top-tier diagnostic laboratory networks, major radiological centers, and premium pharmaceutical chains across the region to ensure our seamless closed-loop referral system works perfectly. Furthermore, our growing footprint with corporate employers and premium hospitality providers has proven the commercial and operational viability of this model. We are continuously expanding our provider network, bringing on board more world-class consultants from both local institutions and the international diaspora who share our vision of transforming healthcare delivery across West Africa.
Dr. Tachi, what you and the team at AllRound are building isn't just an app. It is a vital digital highway for medical equity and system efficiency in our region. Thank you so much for your time, your profound insights, and for leading this charge.
Thank you very much, Priscilla. The future of healthcare is collaborative and digital, and we are excited to be paving the way.
To our listeners, you can explore their specialized solutions, download the app, or inquire about corporate and institutional partnerships by visiting asvclinic.com. Until next time, stay healthy and stay tuned.